As we head into the holidays, let's get another health update from Dr. Isaac Bogoch, who joins us now. Dr. Bogoch, good morning to you.
Great to see you, Jeff and Carolyn.
All right. Seems like if you're not sick yourself, doctor, you know somebody who is right now. So can you put this into some sort of terms for us? Quantify it if you can. Just how bad is the flu season as we head into the holidays?
Yeah, I mean, there's certainly a lot of circulating respiratory viruses right now. Unfortunately, 'tis the season. There's a lot of COVID out there. We also heard last year about influenza and RSV, which of course rear their ugly heads this time of year. RSV and COVID are at where we would expect them to be for this time of year. That doesn't mean things are okay. That means there's a lot of it around because we expect a lot of them to be around. And in fact, we're going to see more and more of it in the weeks ahead. These will typically peak around January or so. I think the take-home message here is if you haven't had your updated vaccine, it's not too late to do so.
Okay. Dr. Bogoch, we've also heard over the years a lot about long COVID, but new research suggests long flu could also have long-term effects on people?
Yeah, this is interesting because in the world of infectious diseases, this is not a new concept. And we know that there's chronic manifestations following acute infections. People get sick, they feel crummy, might have a fever, might have a cough, might be in bed for a few days, but then they just have these persistent symptoms that seem to linger for weeks and sometimes even months after this acute infection. We've talked a lot about it with COVID-19, but for years and years and years before COVID, we've known that this can happen with other infections like influenza and other viral infections. So, just another reason to prevent these in the first place so you don't have to deal with the acute manifestations. And then, unfortunately, some people are dealing with more longer-term manifestations afterwards.
All right. When we talk prevention, is it too late at this point, too late in the flu season to get your flu shot, Dr. Bogoch? And what is your advice for those who will be gathering with family and friends over the next few weeks?
No, it's absolutely not too late to get the flu shot. Flu isn't going to peak until sometime in January. And then remember, when it peaks, you still have to come all the way down the other side of the mountain. So there's still many, many weeks of flu, unfortunately, on our horizon. So it is definitely not too late. I would also say, we're under vaccinating for COVID-19. We know that people over the age of 60 are disproportionately represented in hospital, and only about 40 to 43% of people over the age of 60 have received a COVID booster in the last 6 months. So that's the age group that really needs to protect themselves because they are at greater risk for more severe manifestations. In terms of protecting yourself over the holiday, we've talked about vaccines. I think the other very obvious thing is, stay home if you're sick. There's no point going to get other people sick at a holiday party or a Christmas party. You have to think about people you're visiting as well. You might be seeing elder relatives or people with underlying medical conditions. Again, we've got to protect those around us. So stay home if you're sick. We can improve the quality of air in indoor settings to reduce the risk of transmission. And of course, even without mandates, people can choose to put on a mask in an indoor setting to reduce the risk of transmission of these viruses, to reduce the risk of getting an infection.
And Dr. Bogoch, I was mentioning my little guy, he's sick right now, third day with a fever. Even after he gets over this could be flu. Who knows what this is? He did not get his flu shot this year. So if you've been dealing with the sickness, you're in it right now. Again, kind of follow up to Jeff's question. Do you still recommend getting a flu shot if you possibly have already been infected by the flu?
First and foremost, I hope your little guy gets better and wishing him a speedy recovery. The interesting thing about the flu shots is that they cover for several different flus that are going to be circulating. There's something called flu A, which circulates in the early part of the season. That's what we're seeing almost exclusively now. And flu B, which really starts to rev up in the later winter and early fall. Obviously, these are case by case. If you got anyone who's trying to make an individual medical decision, you got to talk to a healthcare provider, a doctor, a nurse, a pharmacist, a public health specialist. But in general, if someone feels unwell and you're not even sure if it's the flu, it could be RSV, it could be COVID, it could be flu. Because there are different flu strains that circulate, it is not too late to get a flu shot. But again, for individual medical decisions, you've got to get individual advice from a healthcare provider.
All right, just in our final minute, Dr. Bogoch, I wanted to ask you about this as well. This is big news in your world, and I'm sure for a lot of other people as well. This new RNA vaccine that is proving to reduce the chance of recurrence or death from melanoma, which is the most dangerous form of skin cancer. What more can you tell us about this?
So this is fascinating. And for starters, melanoma can be a pretty deadly cancer. It kills over 1,000 Canadians per year. What they're doing is they're using these vaccines to make your body mount an immune response. And of course, we talk about vaccines to prevent infection. So we help our body mount an immune response to fight off an infection. And here what they're doing is they're getting the body to mount an immune response that targets cancer cells. And there's been decades of research looking at how we can harness the immune system to target cancer cells. But this looks like it's obviously early, too early to get excited about, but it looks like there's some very, very significant progress here. And if they can really hone this in and ensure that people's own immune system can target the cancer that's on, in this case, affecting the skin, I think this has tremendous potential. And I think we're going to see a lot more of this in the years ahead.
All right. We're going to have to leave it there. Dr. Bogoch, thank you as always. And happy holidays. Merry Christmas. Thank you.
Merry Christmas. Have a wonderful holiday season and all the best for 2024.